my name's Gorman. I'm a physician associate. I'd like to carry out an examination on your hip today, but can I ask your name and date of birth first?
Yes, it's Mark Reynolds, 26th of August 1966.
Wonderful, and how old does that make you, Mark?
54.
Okay, for the purpose of examination, we'll need you in some shorts. I notice you're already appropriately attired. I'll need to observe you walking at some point, and I'll need to look, feel and move the hip joint. Perhaps also have a look at the knees as well. Would that be okay?
That's fine.
Are you in any pain, Mark?
Not at the moment, no, thank you.
Thanks very much. Action. Mark, can I get you to stand up for me, please? That's great. And if you just face me, that's wonderful. So I'm looking at Mark's general symmetry. He's got a good posture. Shoulders are generally level. Holding the arms in a neutral position, essentially. I'm just going to move down. Do you mind if I find 2 marks on your pelvis?
Carry on.
Okay. Okay. Can I get you to place your index finger where my thumb is, sir? That's great. So we're just getting the patient to mark where his anterior superior iliac spine is. I can see no gross limb length difference. We've got good quadriceps bulk. I can see both equal bulk on the right leg of the medial and lateral vas thigh muscle. Perhaps a little bit less bulk on the vas thigh muscle on the left leg. Have you had an injury to the left leg, sir?
I have, yes.
And have you had some surgery? I notice a scar on the inside of your patella. What have you had?
Medial patellofemoral ligament reattachment and lateral release.
Thank you very much. A little bit of a curve of the tibia and the feet are slightly pronated. Just looking at the hip from the side. No gross deformity. No gross deformity. I also notice no erythema, no redness. Looking from the rear, generally good muscle bulk. Okay, so what I would like you to do, can I get you to take your right leg? Actually, have you any issues with your balance at all, sir?
No, thank you.
Okay, I'm just going to place my fingers there for you. Can I get you to take your right leg off the floor for me? That's great. And down for me. And could you do the same with the opposite leg? That's great. This is Tran Dallenberg's test, and what we're essentially doing is checking that pelvic stability remains when the patient takes one of his feet off the floor. You're actually testing the gluteus medius muscle on the side that remains on the floor. And Mark's pelvis is working well. Can I take you back to the couch? Do you mind if I get you to lie back, Mark? Thank you. So just I'll have another look here. No marks genuverum or valgum. Did you say, Mark, that you have no pain in the hips?
No.
Currently?
Not at all.
Okay. Do you mind if I touch?
Carry on.
Okay, so we've got no warmth around the joints. I'm going to find, if I can, the greater trochanter. Any pain, Mark?
No.
Because we're thinking about whether there's any trochanteric bursitis. Any pain around the joints?
No.
Okay. That's great. It's okay. Mark, can I get you to raise your right leg off the plinth for me, off the bench? That's great. Do you mind if I try a little bit more? Okay. Can you do the same with the other leg for me? That's great. So we've got a more or less equal degree of flexion of the hip, both sides. I'm going to take the patient's, the weight of the patient's legs, and I'm going to look together at internal rotation of both hip joints. Now, people say look at the feet, but the feet actually are too mobile to judge that. It's not perfect, but you're better to look at the patella and treat it like a clock face. So if I internally rotate both hips, there's roughly symmetrical movement to the tune of about 45 degrees. If I externally rotate both, there's a little bit more, 45 to 50, but it's symmetrical. Now, when we check in with the knee not flexed, we have potentially some limitation from soft tissue. So what we need to do now is bend the knee and internally rotate the leg, because we're taking off the influence of the hamstrings. And if we look again, we've still got 45 degrees. And if we externally rotate the hip, we're at 45 degrees again. And repeat that for the other limb. Internal rotation, 45 degrees. External rotation, 45 degrees. Mark, I wondered if you could take your left leg as far as you can across your right leg in a straight line. Bring it towards me. Any further? Thank you. So we're testing adduction towards the mid-sagittal blade. Can you take it out as far as you can outwards for me, Mark? And we're testing abduction. Thank you. Could you repeat the same with this leg? And towards me. That's great. Okay. Have you any, if I get you to lie on your face briefly, put your head to the side so you're able to breathe, will you be comfortable?
That's fine.
Okay, can I get you to raise your right leg, your right leg even, off the plinth for me? That's great. And the same again. That's great. And can I get you to turn as comfortably as you can? Okay, I'm just going to look at ab and adduction while keeping a hand on the pelvis myself. Sorry, Mark. Okay, and then finally we just want to carry out Thomas's test to look for a fixed flexion deformity of the hip. Do you mind if I put my hand under your back, Mark? Okay, can you press down into the plinth as much as you can? For this test, we want to isolate movement from the hip by eliminating excessive movement from the spine. I'm going to take the weight of both of your legs, Mark, if that's okay. Okay. So what I want you to do, I want you to bring your left leg slowly and flat to the couch. Okay, so Mark is almost able to bring that left leg flat to the couch. And if we reverse that situation, so I'm going to take the weight again, Mark. Can you check your press to the couch? That's great. So I want you to now bring the right leg down to the couch if we can. That's great. Thank you. So there's no obvious fixed flexion deformity of the hip, although I did feel some crepitus in Mark's knee there when I guided him down. In addition to the Thomas's test, we can also measure to look for a limb length discrepancy. I'm pretty confident from preliminary examination of our patient, Mark, that there is no significant limb length difference. Mark, would you mind if you just raised your top up so I can see your belly button? Okay, so I've got the patient to expose the umbilicus, and I'll take the tape measure I measure from the central of the umbilicus to the central point of the medial malleolus on the right limb. And I will do the same, checking that my line is comparable and that we're not skewed by any other landmarks. And I have 101 centimetres exactly. You should actually measure it 3 times to see if you can get a consistent reading. That's to measure for an apparent limb length discrepancy, so that would take into consideration a limb length discrepancy that's secondary to a pelvic problem or a spinal curvature. Now, back to those bony landmarks, I'm going to locate again Mark's anterior superior iliac spine. Sorry, Mark, are you okay?
Stop apologising.
And find the centre of it. In an ideal world, we would mark it with a pen. And on Mark's left limb, I have recorded a measurement to the centre of the medial malleolus of 92 centimetres. We'll repeat that up on the opposite side. And as luck would have it, we've recorded a measurement of 92 centimetres. Avoid skewing the line of the tape measure by it passing in a different position when you measure the 2 limbs. And that concludes examination of the hip. Thank you very much, Mark.
Thank you.
Would you like to get dressed?